morning, everyone, and welcome to my house call webinar. I would like to introduce Mike Cole. So Mike actually has a really interesting background, and I'm going to let him share a little bit more about it, obviously, but one of the things I'll mention to you is that he is an experienced chief operations officer, and he has worked in the hospital and healthcare industry for a number of years. He's actually skilled in emergency medicine, cardiopulmonary resuscitation, CPR, EKGs, advanced cardiac life support. And he has a master's degree that's focused in medical clinical sciences with graduate medical studies from St. Francis University. And, I have met with Mike actually when he joined our chamber to just share a little bit more about the unique system and process of what MyHouseCall does. And I'm excited for him to share it with you and tell you more about the possibilities that his company offers. So Mike, I'm going to turn it over to you. You are welcome to share your screen and we'll get going.
Sounds good. Thanks, Jean. I appreciate the introduction. And I appreciate everybody being on this call this morning to learn about MyHouseCall. So Jean gave a little bit of my background. I actually have worked in primary care, urgent care, the hospital system, been doing it for 15 years. I also worked in a laboratory. So my first job was in the laboratory, went to PA school in Maryland. I worked in Alaska, was my first physician assistant job. I worked on an Indian reservation. Then I moved to Pittsburgh, worked urgent care for about 12 years. And now I've been in primary care. So I've seen a lot of different facets of healthcare. And in the course, especially the last 5-7 years, I've seen a lot of the pitfalls in healthcare and how it can be done in a much better, more efficient way. So that's why I created MyHouseCall. So as I'm sure a lot of you know, healthcare is a headache. There's 3 big problems in healthcare. Two of the problems that I start off with here on this slideshow, they've done a survey of Americans and they all say that expense and inconvenience are two biggest problems. Now the fragmentation, I think people are aware of that, but I see that more firsthand in my line of work. So Warren Buffett, I'm sure everybody knows Warren Buffett, the investor, the entrepreneur. He has a quote that's saying, "Healthcare is the tapeworm on the economy." I have a slide on the next show that'll show exactly why that is. Healthcare is also not convenient. It's not geared towards the modern patient. So I'm sure a lot of you people use these services, Uber, Amazon, Netflix, all these on-demand services. Healthcare has not come in line with those type of services. They still deliver services in a brick and mortar fashion. You have to schedule, call people on the phone. It's just not very, very efficient. And the fragmentation comes from not having a quarterback for your healthcare. It used to be you'd call up your primary care doctor 20 or 30 years ago. He would get you in, no problem. But there's less providers going into primary care, one, because it doesn't pay enough. It's not as prestigious as all these different specialists. So what happens is people have long waits they have to wait a long time to schedule. And then they go to urgent care, they go to ERs, and there's 54% of millennials don't even have a primary care doctor. So as I was talking about with healthcare costs. So this graph to your right shows you 20 years of price change in the United States for different services and products. So you can see that like TVs, wireless telephones have actually went down in cost. The average hourly earnings, you can see that sort of there in the middle there, that's went up about 75%. So that's been sort of close in line with inflation. Inflation's about 3 to 4% a year. And this is over a 20-year period. But if you look at the very top of the chart, what do you see up there? Hospital services. That's went up 225%. So about 10 to 12% a year. So if your wages only went up 3 to 4% a year, you do the math. And that's why Warren Buffett says it's the tapeworm on the economy. So why is healthcare so expensive? It's a fee-for-service program right now in general. It's focused on seeing as many patients as possible, volume-based and not outcomes-based. So for an example, if you have a diabetic that is poorly controlled and you can see them in the office, 15, 20 times, and ultimately their toe gets lopped off or they get on dialysis, the provider still gets paid for those services versus if you say, hey, let's manage your diet, let's get you on the proper medications, and, reducing the healthcare cost, you don't get paid as much. So the incentives are not aligned to keep people healthy. There's a lack of price transparency. So if you go to Home Depot, you go to any restaurant, you have a menu of prices for everything. In healthcare, there's nothing up on the wall saying an MRI costs this much, CT scan costs this much, labs cost this much. So there's a wide variation in cost, not directly tied to outcomes, and people don't even know what those costs are. And most of healthcare happens in a brick and mortar facility. And a lot of people don't realize this until they get a bill later. There's facility fees. And those facility fees are just arbitrarily tacked on because they're trying to cover their overhead. That could be hundreds of dollars and sometimes even thousands of dollars just for walking in the door. The other problem with healthcare is it's a shell game of shifting costs. So in 2020, the average premium for a family right now is $21,342. I'm going to repeat that again, $21,342. So just think about your wages, how much of that's getting drawn out from your wages. And the average deductible, high deductible health plan is $4,552. In addition to that, you have copays. So if you have a very high deductible health plan, people are going to say, I don't want to go to the doctor because I have this high deductible health plan. So they let things languish. Or if they have a copay of $50, $100, they're going to say, well, I'm going to have second thoughts about that. That's when their diabetes and their hypertension get worse. They end up with a specialist or ER or surgery, higher cost fees. So we want to be, there should be more proactive solutions to kind of reduce these gatekeepers and increase access. Another problem is there's private equity investment in healthcare. So that's a major issue when you have people pumping money into the healthcare system, looking for an ROI on the money they put in. So they just want to incentivize, they want to have incentives just to maximize profit, not necessarily, again, tied to outcomes of the patient. So why is healthcare inconvenient? Again, go back to the primary care providers. I actually don't have a primary care provider, and I know a lot of people that don't have a primary care provider. So if you call your primary care provider, when are they going to see you? My brother had a medical issue. He didn't have a doctor. And he said, well, I need to get this addressed. He made a call. They said, I can see you in 2 months. So he has something that potentially could be serious, but he can't get into a primary care doctor for 2 months. So that's not a good system. Urgent care and ERs, they're getting worse with wait times. So if you go to ER, you can have wait sometimes of 8+ hours. And the urgent care used to be a system where you could get in, wasn't quite as long a wait, but the problem with that now is the waits are increasing 2 to 3 hours. Plus for both facilities, you have to travel and you have to travel to those facilities. Another major issue is lack of competition. So if you have within a region, you have a monopoly on these health systems and they're raking in money, they don't necessarily have to innovate or change what they're doing because they're already making money hand over fist. How is healthcare fragmented? Like I said before, 54% of millennials do not have a primary care doctor. So that leads to people going to the urgent care and the ER. PCP used to be the main hub of healthcare. You would call them up for any of your healthcare needs. Now that people don't have PCPs, then they're kind of going all over the place. Urgent cares, walk-in clinics, telemedicine, ER. You have basically, you have an illness, you have a back strain or something like that. And you're like, do I need to go to the ER? Is this serious enough that needs the ER? Can I do this with telemedicine? So there's this decision tree and there's some paralysis by analysis. So the treatment is my company, MyHouseCall. We feel we can provide a better solution than what's currently available. So we are a mobile direct primary care service, and I'll break that down for you. So direct primary care, or DPC, is contracting directly with clients, individuals, or employers and not using insurance. So that reduces the bureaucracy. And we're mobile because we focus on house calls, virtual visits. We have no brick and mortar office. So again, for cost, we have a cash pay model. We're focused on the outcomes and we're not driven by volume. So we don't want to see a ton of patients a day just to keep the lights on. We are focused on keeping people healthy, and we bundle multiple services together to keep people healthy. We're also more convenient. We're an on-demand concierge service. So again, people are used to Uber, Netflix, Amazon, all this on-demand care, and that's what we provide with our primary care service in the home. Yep. And we can go to the office too. We also reduce fragmentation because we're a one-stop shop for all your primary care needs. So you don't have to, again, go to that decision tree of, do I need the ER, the urgent care? You can just go to MyHouseCall and get your urgent care and primary care needs addressed. So this is a chart, a little table showing the difference of MyHouseCall versus your typical fee-for-service primary care or urgent care. So with time spent with the patient, I work in primary care now. It's a low margin business, so we have to see a ton of patients to keep the lights on. So I can spend on average, this is a study across the nation, on average how long a primary care doctor spends with a patient, 7 minutes. So what are you gonna find out in 7 minutes if they have multiple issues, multiple comorbidities? You have to kind of rush them through, address their issues. Since MyHouseCall is not worried about seeing as many patients as possible, we have lower overhead. We can spend more time with patients. Again, we don't have the travel time, the waiting room, none of that stuff, because we come to the patient. We have no copays or deductibles to worry about. That's all included. You just download the app and hit the button. You don't have to worry about putting in a credit card or anything like that to access our services. We also include mobile imaging. So we do x-rays, ultrasounds, and that all happens within the home, and EKGs. We also have certain prescriptions, and that's about 500 different prescriptions included in our cost. Those are acute care prescriptions like antibiotics, and then some common diabetic, hypertensive medications too, all included. We have basic labs included, like a lot of the labs that you get in your doctor's office are bundled right into our price. We also have weekend hours, and that's a real big deal because when I work in the urgent care, we would get slammed all weekend long, because what happens is the primary care doctors, the vast majority, don't have any weekend hours. There's no access, and people just flood into the urgent care and the ERs. And the problem with that is if you go there with back pain for the urgent care, the ER, whatever your issue is, they're going to say, well, you need to go to your primary care doctor. So that creates fragmentation again and double billing. We also include physical therapy. The main driver of cost for employers is MSK, or musculoskeletal issues. So what happens is if you don't have physical therapy on your side and something comes up, a back issue, a knee issue, and they don't go to the primary care doctor, they don't go to a physical therapist, they end up going to a specialist. And what a specialist wants to do, a surgeon, that's how they make their money. So they want to do surgery, and they want to do injections. And those are high cost procedures that can cost tens of thousands of dollars, have about the same outcomes, and sometimes even worse outcomes for knee and back issues. Much more expensive. So here's how the system works, MyHouseCall. So there's an app. The employee downloads the app. There's also dependents. All dependents are included on the app, or anybody else in the household. They put in a request. We have a MyHouseCall clinician. They triage the individual. Commonly, what we'll do is just do a virtual visit to start with. They say, hey, I got pink eye, I have a rash. We'll say, well, we could just probably handle this with a virtual visit. But let's say you roll your ankle, you fall down some steps. We look at that ankle and say that definitely could be fractured. We can put an order in for an x-ray. The x-ray tech would come to the house, do the x-ray, and then we could follow up with a house call and keep developing that relationship. Again, to the treatment, we can do the treatment in the office or home, and we focus on evidence-based care. We're not focused on just whatever care we want to do. We want to focus on things that are evidence-based to have the best outcomes. So MyHouseCall is more than a strong ROI. Of course, we have an ROI based off of reducing urgent care, ER, and specialist claims. We have some of these soft benefits too. So productivity. When an employee knows they have better access to healthcare, it reduces their need for PTO, and that improves their social well-being. So if you have a child that gets sick, and then you're like, again, I don't know, they seem pretty sick. Do they need an ER? Do they need urgent care? Should I call my pediatrician? You can just go onto the app. You can do a virtual visit, and then we can sort of direct the care. Yeah, we can manage this in the home, or they look like a little more sickly. Maybe they're septic. They need to go to the ER. Accessibility. So we're the main hub for all of your primary care needs to reduce that uncertainty. And also there's rapport. So when you use an urgent care service or a telemedicine service, you get a roulette wheel of providers. Each time you go on and do a telemedicine service like a teledoc, you're going to get a new provider, and you have to kind of start over fresh. And healthcare is built on relationships. So unless you have that rapport with that individual, there's not going to be as much trust in the decision making. So it's really important to develop rapport. So that's my general information. I can go back to that if need be. I'm going to show the team. So our core team members are Dr. Kusti, myself, and Alex Coons. So Dr. Kusti, he was a medical director of US Steel prior. He's worked with a lot of different, he consults for a lot of different employers, and he focuses on occupational health. Alex has worked with Highmark and with a lot of different startups, and he's focused on innovation. He's helping us with strategic growth and marketing and research and development. And this is the app. So we kept it very simple, very bare bones, because user experience is everything. If it's too complex, people won't use it. After you download the app, you put your medical information in, your demographics. Then all you need to do is put in your symptom and put a request in. You have all your notes bundled in right in the service. That little hamburger thing up in the left-hand corner, if you click on that, you'll have all your notes available. And then we have a provider side app too that has all the notes and everything available too. One other caveat too that I didn't mention, we're actually looking into adding some behavioral health too. We're talking to a consultant locally. So we want to continue to expand our service offerings to make it more robust and just, again, keep people healthy and keep people well. And that's it.
Now, does anyone have any questions? John?
It's a question, Gene.
And please introduce yourself, of course.
Okay. My name is John. I'm an account executive with the Hershey Insurance Agency. And but how does this replace someone's existing health insurance? I mean, I don't know if you saw in the comments. I mean, you know, of course, we're coming in the new year, annual enrollment. If you know, I pay $8,000 a year for insurance, and then it's like, well, I have to pick one system or the other. You know, how does that work?
Yeah, we're not here to replace insurance, but if you think about it, what should insurance be for? Like your auto insurance, your home insurance, it should be for catastrophic things. Okay, if you have a bad event, it should be focused on emergency visits, surgery, not your primary care. So we could plug into high deductible health plans and have our service available. We're focused on contracting with self-insured businesses too, directly. So again, we're not looking to replace insurance. We're looking to augment it, especially with self-insured clients, reducing the urgent care, ER visits, and specialist visits.
Okay.
Make sense?
Yes, thank you.
Mm-hmm.
Hi, Mike. Denise Sherwood. How are you today?
Good. How you doing?
Good. I just have a couple questions. So I'm interested. You just mentioned self-insured employers. So are you marketing this to employers? And
yep.
Do you charge a fee per employee per month, or do you have like a sliding scale, or is it by mobile app? So just curious how you're pricing this.
Yeah, when we started off, we did direct to consumer and we got some good testimonials. Patients loved the service, but we realized to scale this up, we needed to go after employers and specifically self-insured employers. So that's who we contract with, is self-insured employers. And we charge $35 PEPM per employee per month, which includes dependents. And that includes everything, all the labs, all the imaging, unlimited house calls, virtual visits. There's no like hidden cost or anything extra. It's all bundled right in.
So Denise, I don't want to interrupt. Did you have any further questions?
No, that was just my main question. And then I'll probably circle back with Mike and see if we can have coffee.
Okay.
I always have more questions. I have more questions that would take the rest of the morning.
No, it's only
coffee.
Well, I guess we're here. If you have any other questions, any general questions, you know.
Yeah, I'm curious to learn more. We work with employers all throughout Southeast Michigan, so I see definitely a need for this. So just we'll have some additional questions for you, but we can do that over coffee, getting into the weeds and the details. All right. Yeah. Thank you.
Yeah.
So Mike, there are a couple questions in the chat. One of them, Ryan, did you want to, it looks like you unmuted. Did you want to ask him your questions?
Oh, I totally didn't know I unmuted. Sorry about that. Mike, thanks for sharing today. I'm Ryan Coral from Tell Studios. I use a health share for our family, but I've got a few employees that I would love to. We've looked at insurance like every other year, and it's just like it makes zero sense. It makes sense for me to just pay employees more and for them to do private insurance. So
Yeah.
I am curious to know, like, what is the, like, if I did want to get more info, I would actually probably introduce you to my operations guy, but what does that process look like?
Yeah, I can give you my email. Maybe Gene can share that with you too. And I can send you over literature. So we have marketing materials that kind of have, testimonials, projected ROI, VOI, value of investment. We have a number of different documents that I could share with you.
Sweet. Yeah, that'd be great. I'm
Okay.
gonna mute after this too. Sorry. Sorry.
That's all good. And I see that Jonathan has a question. Who is this service ideal for? So I would say it's ideal for anybody, but specific targets would be companies that have parents with young children. So we found that they gain a lot of value from it. So if you have, let's say your daughter wakes up with a fever of 102, she's screaming her head off, and then you have to bundle everybody up. It's wintertime. That's a huge hassle, especially with a lot of people working from home and they have their kids at home. If you have to bundle everybody up, that's a major inconvenience. Whereas you could have your daughter just rest in her bed, do the MyHouseCall app. We can come to the home. We can do the rapid strep test. Then she doesn't have to go to the pharmacy. We give her first dose of antibiotic. Just a much more convenient customer experience than what's currently available of going to the urgent care and waiting the urgent care. And then other companies that I think would be ideal would be manufacturers, logistics companies, warehouse companies that have warehouses. So men, they tend not to seek out healthcare as much, and they let things languish. One, they don't have a primary care doctor. They don't want to waste time going to the doctor, even though it's not wasted time. We found too that a lot of these men will download the app and they'll get seen in the home. They feel comfortable being seen in the home and they're okay with that. They just don't want to go to the doctor, or we can see them in the office. And they suffer from a lot of the MSK, the musculoskeletal stuff with working in the warehouse, knees, backs, that kind of stuff, where we can start with the physical therapy and help relieve some of those symptoms and reduce the high cost specialist surgeons. I'm going to drop my email address here for.
Yeah, I was just gonna say, I was trying to do it actually for you, but I appreciate you putting it in there. Thank you so much.
Jean, can you hear me?
Yes.
Okay, so I just want to pop in here. The artists are usually the harbingers of the future. This is an awesome thing, and it's going to be the future, but people are afraid to do it. I've had my guy since 2018, and I absolutely love it. I mean, when I go in for an appointment, and I can see him down the road doing the telemedicine, this is more of like old-fashioned family doctoring, only with a new twist because we have the internet. It's an awesome program, and people are going to be worried like, oh my gosh, this isn't like what I'm used to, but this is what people used to do, where people cared about each other. And so I love this. It is the way of the future. Everyone's like, oh my God, I have to have health insurance. Well, no, you need someone to help you when you're not healthy. It isn't about insurance. It's about having somebody care about you. So I'm all for this. It's just going to take a while to get people used to a brand new concept because we're so used to the old model.
Exactly. That's it. And that's the thing. We're a mix of the old school and new school. So we still do the virtual visits for the triage, and we can handle some things there. But with the house calls, very nice, very complimentary. And healthcare, telemedicine is great, but healthcare, again, is based on relationships, rapport, seeing someone eye to eye, being able to do that physical exam. So we augment it with that house call service. And that really helps to be a major value add. And then we also have, like I said, the physical therapy. We're looking at bringing in behavioral health. We want to have more of a holistic approach to healthcare. It's not just seeing your doctor, getting uphill and see you later, see you in 6 months to a year. We're going to see you, of course. And then if you need some behavioral health solutions, if you need some physical therapy, we can just do different things than what's currently available. I guess they're available in some regards, physical therapy and mental health, but a lot of that stuff's siloed and there's poor communication. So I work in primary care. If I want to do a behavioral health consult, I put it in and then I don't even know where it goes. And I don't ever get any report back, and it's a mess.
Yes. Keep on keeping on. This is awesome. It's going to be the future, especially as the population ages. It's an uphill battle right now, but down the road, you're going to be busier than crazy.
Thank you. I appreciate that. I think so too.
Yep.
a question came through, and it actually came through directly to me, but I'll ask it. So one of the things someone was wondering about, and maybe you can just touch on this a little bit, is referrals. So if somebody
Sure.
does have something where they need, maybe a specialist, how does that get handled?
So ideally, what we like to do is we like to manage as many people in-house. Of course, there's some patients that are going to be complex, especially like diabetics. If they are having really high A1Cs, which is like a test of their diabetic control for the past 3 months, really high A1Cs, and we just feel like we can't manage it with just our platform, we're going to refer them out to an endocrinologist. So the company is still, if they're self-insured, are going to still pay for that service, but we want to try to prevent as much of that leakage out to those specialists. But yeah, if you need to see a specialist, we're not going to just try to keep you in-house. We'll refer you out when we see fit.
Thank you. Awesome. Okay, any other questions for Mike? All right, Mike, did you want to wrap it up? Any final comments?
Yeah, I appreciate everybody being on this call, learning about MyHouseCall. And I got my email there. I also left the website. You can reach out to me. I can supply you with any information. If you want to do a follow-up call or another webinar, I'm open to that. I have a lot of flexibility right now. We're looking at, I think, potentially if you have a client right now, and it's a little bit later in the year, but if we could identify a client, we could potentially even launch here in January. But it may be that we're looking a little bit later to like July of next year to launch with some clients in your area. But there's always the potential for January.
Wonderful. And I'll share, we have recorded the webinar, and so we'll be posting it on our website. And so if anyone would like to review and or take a look at this again, and then Mike will follow up, obviously, and share contact information and give you all an opportunity to reach out to Mike directly if you have further questions. So thank you, everyone, for joining us this morning. And thank you, Mike, for taking the time today and sharing the information about MyHouseCall. I do agree. I think this is such a great opportunity for people.
Appreciate it, Jean. Thanks for allowing me to present.
Our pleasure. All right, everyone, have a great morning.